everyone, and welcome to another episode of the Med City Pivot Podcast. Today, I'm your host, Katie Adams, an associate editor here at Med City News, and I'm excited for this episode, which is brought to you by Quantum Health. So, Quantum is a care navigation and benefits guidance company, and it works with employers and health plans to kind of help their members use healthcare in the most efficient way possible. So it often serves as sort of a front door for employees when they need help with something healthcare related, whether it's finding a doctor, understanding their bill, problems with prior authorization, managing a chronic condition, all that sort of stuff. But my guest today could probably tell you a little bit more. So I want to welcome to the show Shannon Skaggs, who is Quantum's Chief AI Officer. Thank you for being here today.
Yeah, thanks for having me.
Yeah, of course. So you've been working at Quantum for about 2 decades now. So you're a bit of an expert in the healthcare space for sure, but also the healthcare AI space. And when it comes to healthcare and working with these employers, health plans, I don't think it can be overstated just how important data is and how much data matters. So I'm wondering if you can explain kind of why that quality and completeness of data is so important as we're continuing to add more and more AI tools into healthcare.
Yeah, great question. Again, thanks for having me on. Yes, been in healthcare for a couple de When you said that, I flinched a little bit and was like 2 decades. I guess you're right. I was dropped as a baby on the doorstep of Quantum Health 20 years ago. Um, but helping people navigate through some of the hardest times in their life and unchosen journeys is kind of what we specialize in. And to your point, the data matters. We would like to talk about technology. I'm, trained in technology, love it, but sometimes we don't think about the data in which we run our technology. So, AI is a great tool that we all use, but if you have a limited data set, so like in our world, 6 million interactions last year, half of those are with providers and half of those were with members. If you're only running off, say, member data, it's not that you don't know what's going on, but you don't have both sides of the story. And then, at least our clients, we've integrated with 700 point solutions. So knowing what's going on in the ecosystem around a person going through healthcare is wildly important from a data perspective so that you can see what's actually happening. Sometimes we as members don't actually know what our providers are doing, checking eligibility, putting alts on file. All of those things are somewhat, behind the scenes to us as consumers, but really matter on how your care is delivered, the quality of care, and the timeliness of care. So that data set is important. I'm a numbers guy, so I always go by numbers. So like we mapped, 6 million journeys last year. The average healthcare journey is 11 months long. 5 to 7 providers you will see. You'll make 41 decisions on average in that 11-month period, and almost 50 claims are filed on your behalf. So you can imagine if you're working with an inferior data set that doesn't have the full view, you're going to have your answers, the output is only going to be as good as the input that you do for your platform or your AI, or even just a conversation between two human beings. If I'm not privy to that. So again, it's very helpful in the AI world to have a good data set, but it's not just a nice to have. Like in our world, it's a clinical necessity to have the full picture, because these are human beings' lives. I don't mean to sound dramatic, but like this is important stuff that you really have to have a full view, not just a partial view.
Yeah, and achieving that whole picture, as you said, with both sides of the story or all sides of the story being told, it can be difficult. So, definitely something the industry has been working toward for a while now. And
Yeah.
when we're talking about using that data, applying it to new AI models, new algorithms, I think a lot of the use cases have been kind of around shifting the healthcare system from a more reactive sick care system to a more proactive system where we can get ahead of potential adverse events or the worsening of certain disease states. Um, what does that look like from your perspective, particularly when it comes to the guidance and guiding people to the right care and at the right time?
Yeah, really good question. Similar to AI, like AI, when we first started playing with um, Chat GPT and other models, you ask it questions, you get an answer. It's kind of reactive in nature. And then we evolved more towards agentic, where it's doing things. So I think similar in healthcare, you can't really wait until something goes wrong. I mean, it's good to have someone there when something goes wrong. But if you truly map journeys at a larger scale, 6 million last year, multitude of journeys, if you have the provider interacting with you before the member, what do providers do just naturally in healthcare? They check eligibility, benefits, and see if there's requirements around authorizations. That's for payment. I mean, it just comes as simply down to like, does this person have benefits and will I be paid? Those are often just used as transactional moments, approved, in network, out of network, auth, yes, send clinicals. But if you use those as real-time intercept moments to say, wow, I've got a radar. This provider has never checked eligibilities on Shannon Skaggs before. And they're of a certain type. And I know, what sign, if it's an oncologist. Well, that's a new journey. And that's often before the member might even know what the journey is going to be. So making sure that you're capturing that data and then acting on it. In this case, you don't even really have to act with the member as much as making sure the provider has everything they need for that member's journey. So that's when, our platform is suggesting things to the provider and saying, did you know they have a center of excellence for some things, or they have a benefit, a great point solution benefit that they could use. Here are a couple other things. If you need authorization, here's how I can help along the way. That's very different from waiting for something to hit a administrative snag, which often shows up to the member as either denied care or delayed care, which in cases like cancer can be the worst thing, waiting. So using that data and AI to get ahead of that and say, journeys like these, on average, I was just looking at a specific cancer journey, 7 major milestones, and there's often snag points or stopping points at the beginning of that journey that are somewhat administrative in nature, but the member isn't really privy to it. So using the full set of data, grab that data and do something about it, not just point somebody in a direction, but physically like pick up the phone in our case and call the provider and say, can I help you get those clinicals? What else do you need? Is a very different proactive version of healthcare that I think we all think happens, but unfortunately doesn't happen very often.
Yeah, there's very clear potential for much better patient outcomes, especially when it comes to things like cancer, as you mentioned, waiting until something starts to present itself as a problem, can really take something from a situation that could have been handled to, maybe a fatal or near fatal situation. So obviously important work to be done there in terms of patient outcomes, but I would also imagine that reduced costs, lower costs could be a downstream effect of all this as well.
Yeah, definitely. I mean, obviously, we think about results, financial outcomes, clinical outcomes, experiential outcomes are all affected when you're as upstream as possible and as early as you can possibly be. No one wants to go through extra healthcare just to be ruled out. It's healthcare again. I before this I came from retail. That was a little more fun. You actively chose to go buy something. It was a pleasurable experience, and it's not a knock on healthcare. It's a great space to be in, but we often are dropped into the healthcare store unwilling, and it's somewhat of a surprise. And going to extra aisles in that healthcare store is usually not productive for you, the patient, and for the employer is costly. So making sure you're dropped at the right point, at the earliest point in that store, and pointed to the right providers or aisles in this metaphor, um, to get the care that you need, gets you care faster. So there's a experiential part of that, but there is tried true science behind, specifically in cancer, No one can, no one wants to wait in cancer. The faster you can get after it, you can get to the right treatment and start going through the protocol, the better your outcomes are, and the less extra services means the cost comes down. So it truly is, it sounds cliche, a win-win if you can get there early, less hassle for the member and less expense for the employer in this case that's funding or any other funding source of the health plan.
That makes sense. And another thing I kind of noticed when it comes to deploying these new tools, I wonder how leaders are differentiating what is just going to produce more kind of annoying pop-ups and what actually can deliver that actionable insight that creates behavior change.
Yeah, I mean, we're all busy. I think I mentioned earlier 41 decisions. The last thing you want is 41 different questions asked of you at the beginning of a healthcare journey where you don't actually know what to expect. I think what at least we've learned is that you need a human interact, like we have humans in the loop that are interacting with people with great systems that are narrowing it down to the most impactable things that we can do at this milestone in the journey. We don't need to worry about all 41 decisions at this moment. But we do know, specifically at the beginning, where you start your care, how that gets started, with what team of providers and what protocols get used at the beginning really matter as you get farther down in the case of the cancer journey I referenced in 7 milestones. Once you get past milestone 2, 3, and 4, where you've selected, it starts to matter about your outcomes and how you're experiencing this journey. So making sure that, of course, our system could tell us all 41 things you should think about. We as human beings, no more than 2 to 3 things that we need to get done on this interaction. And I think what's often missed, there are services that tell you what to do. Here, you should go do this. Go tell your provider that. Well, think about that. If I'm on, say, the cancer journey, I'm not at my best. I probably don't have all my executive functions. And am I in a position to push back on my provider and maybe question something that's going on? I think the key, for us at least, is I can suggest those things and then offer to say, do you mind if I reach out to your provider or if you want me to do it with you, let's do it together. Like that's usually insights are delivered at mass on many platforms. People picking them up and knowing what to do with them. I think what, at least in our world, it's not good enough to find them a solution. You have to do it. And obviously with permission to say like, hey, I'm willing to reach out to your provider and have this conversation. Are you okay with that? The answer in that is often yes. Some members want to be on the phone or on the interaction too, but often they just want to feel better and have something taken off their plate because they're not on this journey because they wanted to and they feel great often. So the more you can take off the plate, inform, make sure they're actively involved in the decision as a member, but the more you can do, the higher connection or conversion to whatever that insight may be. I think we all have great insights we want to deliver to consumers. Turns out we're all busy humans and life gets in the way and we don't have time to look at 41 insights on the current journey I didn't want to be on to start with. So I think that's how at least we think about it.
I think a lot of what you were saying toward the end there had to do with the fact that everyone is so different. And it's really going to look different for every single person. And healthcare can be so personal. I think that a lot of the new AI tools and technology we've seen come into healthcare in the last couple of years really have to do with that personalization. And really, for a company like Quantum, I think personalized outreach, personalized engagement is definitely a priority. So hopefully, you can talk about how that gets people more involved in their healthcare. How I'm wondering, how does that help patients, members take more ownership in that healthcare journey?
Yeah, I think the the personalized nature, just the fact that someone, whether we have plenty of users on the platform that want to just go solely digital. Often the higher the complexity of a journey, the opting in of interacting with a human being, a human in the loop, along with our technology. And something as simple as saying, here's the journey that I think we're taking, we're getting ready to go on. Just being able to say, like, on average, there's about 7 milestones along this journey. Yours will be unique, but here are the things we want to start thinking about, like we start thinking about. It immediately brings down the shoulders of a person that's, just had their life turned upside down. Um, and lets them know, like, if I don't know, I at least have, in our case, we call our employees healthcare warriors, but I have a warrior on my side that will take care of this. And will, may not have all the answers, but I bet if I have some questions, they'll find the answers for me. So I think if those are generic and, like, of course there's protocols for a lot of conditions, but, like, often what's important to people, I want to get through a healthcare journey in a productive way with good outcomes. But there's the experiential or humanistic side of things, like, how do I tell my family? What are my like, I want to walk my daughter down the aisle, or whatever that thing, that goal that you want to set. Knowing that is often just as important as knowing what the care path or care gap might be, because to unlock any of that, we all know we should be doing other things and following care paths, but without that motivation and understanding the human at a personal level, um, it's harder for people to think about the more clinical things without anchoring it back to something personal about you. So I think the beauty of AI is that with the right data set and then understanding the human, not only from a medical perspective, but, like, what makes me tick and what are the goals and what are my anxieties around that? That's the personalized, medicine I think that we're all after. Having someone that kind of go along that journey that has seen multiple journeys, whether that's through data or through experiences, kind of help and guide you along the way. I think that's what the personalization brings. If you do that, then you don't have to worry about the old engagement model. You're trying to dial and talk to people at dinner time when no one wants to talk to you. The timing of that, if I've already interacted with your provider and I know what's going on, I instantly have credibility at the moment that it matters to you. Often those old engagement models call you off a claims trigger 90 days after you had something done. You've already made all your decisions. So I think those engagement models and making it personalized and, most importantly, timely. When I'm making the decision, as close to the decision as possible, that's where, AI, largely people, come into this model to make that happen.
Yeah, it's exciting that AI can kind of speed up that process and make that type of personalization more achievable. And I think, we're only going to get better tools the more AI advances, the more developers work on it. I'm wondering what your take is on that, just how fast the pace of AI development is moving, and kind of the chat that presents a lot of
Yeah.
opportunities, but there's also some challenges there that healthcare leaders face in trying to keep up with that rapid evolution, ensure that use is safe, ethical, um, doing well over
Yeah.
time. Can you talk a little bit about that?
Of course, this technology is moving faster than any other, technology I've experienced in my lifetime, including the internet. Um, so I think as a technical person, if I put my technical hat and take, my, business hat off, I want to play with the new toys, the new shinies. I like the new models. I want to use the things. That doesn't mean that we need to. These are human beings' lives sometimes at stake. So there is a tendency to run as fast as things get released. But in this environment, we're weekly getting releases of new impactful tools. So, my advice, and how we do it here at Quantum Health, we're very aware of what's coming out and what's new. And, when the agentic came out, we were playing with that. But how does it apply to the member's journey? How do we still make sound clinical decisions? We can't hand clinical decisions over to AI and have it make those decisions. Those are still human in the loop decisions for us as an organization. But at the same time, how can we provide as much context and much backstory to those insights to deliver to the experts that need them as fast as possible? That's kind of our North Star. Whether we use the fanciest new model or if we're doing good old fashioned NLP and classic machine learning, you don't always have to default. I have chief AI, officer is my title. So people I think AI is the only lane I stay in. A lot of our solutions use hybrid technologies. Like you don't always have to use AI. Sometimes a good old fashioned machine learning or even a classic development solution offers. Or in our case, good old fashioned human connection can go a long way too. So I think staying grounded, enjoy the excitement. Don't get overly hyped up over what came out this week. Does it make sense in your business? And then, of course, you have to look at it through the security lens. How much bias is being introduced to your models? How much data are they being trained on? I think the good news is there's a lot of great projects out there that people can learn from, where we went from large language models to small language models that are more focused to reactive AI to proactive agentic AI. Like you can do that proof of concept and innovation work relatively quickly and roll in or out of technology relatively quickly at the speed that we're moving. So I think that's a good thing. Organizations could also get proof of concept out. Like we got too many going and nothing's actually getting in production. That's the balance that I think organizations have to strike to make sure that they don't lose sight of what their North Star is. And even in our case, making sure no one's alone on their healthcare journey is a pretty simple thing to think about. But sometimes the excitement of AI makes you want to do a bunch of other things. So the focus, the maniacal focus on what the member and providers need, at least helps us stay grounded. That doesn't mean we don't get to play with fun stuff. Believe me, we do that. But be okay that your proof of concepts don't come off the shelf. It was a great idea, but we weren't ready for it yet. I think that's what I've seen other businesses or leaders kind of fall down a little bit and think that every single one of their experiments, renovations has to come to life. Be okay with a couple of them sitting on the shelf for a while because it's just not the right time or it's not secure enough at the moment.
So don't give into the hype and don't be afraid to kind of revisit something when it makes more sense down the
Yeah.
road. I think that's good advice. We don't have too much more time here, but I want to kind of close on a positive, hopeful note. So if we look toward the next 3 to 5 years, I want to know what you think your biggest hope is for how machine learning or AI will change the healthcare experience.
I think we have the possibility to have, we talk about personalization, customization for me. When, AI can be terrifying, to be honest. Some people get excited about it. Some people think it's the Terminator coming for all of our jobs and something, very dark. The hopeful, my hope for the next, 3 to 5 years, that's an accessible technology that we can have our own models. As terrifying as it sounds, the Shannon Skaggs model that knows inside and out what I'm contemplating. Think of the way we talk to AI now and reveal things. Our own personalized models that we get to share with people or organizations to get us better, in this case, outcomes in healthcare. But why limit it to that? It could be anything in our life to have our own personally trained model that can be customized to the world around us, can kind of customize to us and configure the world around us. I think, from what I've seen in the speed, we're not far from that. There is some scary data privacy stuff that we'll all have to get used to. We've all evolved in that way too, but we should be, very careful with our data. At the same time, knowing who has access to it, my hope is that we have each one of our own model, and we get to say who gets to interact with it, Quantum Health or any other organization, to get me the best outcomes for whatever service. I think that's a very interesting and um, important idea that takes the administrative things away from our life and lets us be present for our kids, family, friends a little more, and worry about less things, in this case, healthcare, but could be applied to any industry. It's, it's almost like the superpower that we could unlock via our own personally custom trained models on us. Um, that hope comes with a lot of regulation and other stuff, but you asked me for a hopeful question, so I'm not going to go down that other path right now.
Yeah, there's certainly some questions, regulatory and privacy wise, that would have to be answered. But that is exciting in our own personal model for everyone. And like you said, yeah, I don't think we're all too
Yeah.
far from that. Definitely something to look forward to and think about. And you left us with a lot of different insight and kind of a look into what these AI models look like today, and especially what they look like at quantum. So thank you for all the insight and
Yeah.
thanks for
Thanks
being
for having
today's
me.
guest.